Worldwide, familial Mediterranean fever is a rare disease, but about 1 in 5 people of Mediterranean descent are carriers of familial Mediterranean fever. Other names for familial Mediterranean fever include FMF, periodic disease, periodic fever, paroxysmal syndrome, and benign paroxysmal peritonitis. The modern name, familial Mediterranean fever, was created by Harry Heller. FMF was first described in 1945 by Dr. Shepard Siegel, who reported it under the name benign paroxysmal peritonitis. It was later explained in 1997 by French and American study groups. Familial Mediterranean fever is an inherited autoinflammatory disease, meaning that it is a disorder that causes inflammation and is passed from parent to child. Types of symptoms include rashes, fever, body aches, and swollen joints. People with FMF can live a normal lifespan if their symptoms are treated quickly enough and if the medication is effective. Familial Mediterranean fever is an autosomal recessive inherited disease. This means that a person would have to have a mutation in both copies of the MEFV gene to be affected by the disease. These mutations are inherited from parents who are carriers of the disease, meaning they have both a mutated gene, but they show no symptoms of the FMF. In rare cases, FMF is passed down in an autosomal dominant pattern. This means that only one mutated gene is inherited, but the person is still affected with the disease. Possible symptoms include recurrent fever, abdominal or chest pain or inflammation, swollen joints, red rashes on the legs, muscle aches, headaches, and constipation, usually followed by diarrhea. Some effects of having FMF are weakness, dietary restriction, must avoid events, situations, or jobs that could cause stress, and physical activity must be reduced. Doctors can determine if a person has FMF by using a Tel-Hashomer criteria, which includes certain conditions and symptoms that a person must have to be diagnosed. A diagnosis can also be made using physical exams, reviewing family medical history, blood tests, and genetic testing. People with familial Mediterranean fever who keep up with their symptom treatment have a good chance at living a normal lifespan, unless proteinuria develops before treatment is started. Amyloidosis can also occur if FMF goes untreated and can lead to kidney failure. Otherwise, patients should live over 50 years old thanks to medication, dialysis, and kidney transplants. Limitations in physical activity and diet will be significant, but they are not debilitating. Family members will have to help them pay for their treatments, which can be extremely expensive. Financial strain will be the biggest impact on their family. There is no treatment for familial Mediterranean fever itself, but the symptoms can be treated. Non-steroidal anti-inflammatory drugs can be used to treat the symptoms. The most effective of these is quinine. It helps prevent FMF attacks and protein buildups in the kidneys. Other medications like thalidomide and etanercept can also be used to treat symptoms. Routine treatments for kidney failure, kidney transplants, and dialysis can also help treat complications that can become fatal. There is not a possibility of gene therapy to help treat FMF. The Cleveland Clinic is currently trying to find a cure for FMF. They are also researching other medications that could treat symptoms and complications the disease causes. They discovered that rilonacept, which blocks interleukin, a natural protein in the body, reduces the frequency of FMF attacks. Rilonacept could be used if a person is choline intolerant or resistant.